The World Health Organization recognizes World Mental Health Day as October 10th every year. In South Africa, the month of October has been set aside to educate the public about mental health-related issues with the objective of reducing stigma as well as discrimination that's often associated with mental illness. A study recently showed that over 65% of students in higher education institutions experienced mild to severe psychological distress. That was during the COVID-19 pandemic. Let's talk now to Higher Health CEO, Professor Ramneek Ahluwalia. Prof, a very good evening to you. You were involved, I believe, as an organization in that study. Talk to us more about those trends and how they've shifted, at least since the post-lockdown era.
Good evening, Tembi. Tembi, definitely, it's the most fastest and probably the biggest pandemic the world has ever seen, which is mental health. WHO's latest study of 2020 shows 1 billion people in the world live with this disease. And most importantly, 1 in 5 young people in South Africa, including in higher education, are highly vulnerable or susceptible to mental health, means they suffer from mental health diseases. And approximately 4% of the total population of young people suffer from severe mental health. So this is a very serious issue, irrespective of COVID or not. Of course, COVID-19 was a trigger and exacerbated quite tremendously or immensely the mental health epidemic. But the pandemic or epidemic remained in South Africa. It's been before COVID-19, it still remains, and it's quite visible. It's still persistent, and it remains the biggest challenge for us as a nation. So what the study is pointing out was predominantly what young people or students experienced during the COVID period. But the situation post-COVID, as I speak to you, is better. But do you think we are away from this pandemic? Not at all. This pandemic still remains the biggest challenge South Africa has to have when it comes to diseases or health pandemics.
And I would like us to expand a bit more on what you mean when you refer to psychological distress. What are we speaking to specifically?
So tell me, we are talking about issues that are related to multiple issues. We start with anxiety, we look into depression, we're talking about suicidal ideations, which is severe. It talks about issues of post-traumatic stress, stress induced to violence or trauma. It involves academic stress. It involves a multiple significant both symptoms and factors as well as challenges of mental health that are experienced by young people or in predominantly South African population. What's coming out, Tembi, is that 75% of all mental health cases globally come before the age of 24. And in fact, 50% of all mental health cases come even before the age of 15. That's what WHO is trying to emphasize, signify is that young people remain the center focus for mental health, which means programs that have to be put for primary health, programs of awareness for the days that's today. And what Newzroom you are doing, Tembi, is trying to bring education and awareness. So speaking to parents, speaking to guardians, speaking to academics, speaking to teachers in high school, speaking to students is very critical because that's where the onset starts.
Just on that, I mean, if you're looking at someone, for example, who is 25 or younger or even 15 and younger, and they are dealing with some form of psychological distress, I wonder if age adds to an ease in detection or more of a complication.
In fact, mental health overall is a complication because of the stigma attached to it. Very less educated epidemic, very less spoken epidemic, stigmatized epidemic, where people are not willing to talk or there is no peer-to-peer influence. So the aim is to speak to the parents, the guardians, to identify young children who are showing some kind of symptoms. Very common symptoms will be a young child will be isolating, not eating well. His academic scores are going tremendously down, sleeping too much, or the sleeping pattern changes. Simple signs that one can be observant and understand a young person or a young child, because it's about not spiritual, it's nothing. It's a disease. It can happen. It's got genetic predisposition. People who have mental health, the children can have mental health because it has got high predisposition. So factors around which are prevalent in South Africa. We are a 27-year-old young country. Children are born of single mothers. They've seen abuse in young ages, so they are highly susceptible. So watching symptoms and signs in early interventions, which means if we can put support structures early, this can save a lot of lives to us. What eventually happens is fatality to mental health, which is gone to a stages of irrepair methodology, which we can repair far earlier if we intervene early. So I think understanding and knowing mental health is very, very critical. And that's why education awareness is very sensitive to all this.
Just on education awareness, because mental health is an issue that cuts across cultures and social class, making the conversations accessible and understandable in people's most plain form of language. Are we making progress in terms of that?
Maybe I can tell you from where we found ourselves to what intervention has been done. What we've done is we've actually, the severity I spoke to you, or the data I spoke to you, has prompted that, say in higher health, we've got now a curriculum on mental health. It's a co-curriculum program across all universities, TVET and CET, specifically knowing that's the age group where the onset is predominantly extremely high and the vulnerabilities are quite severe. So the peer-to-peer participatory pedagogies, engaging one learn, teach other, one teach the other. These are methods of building a peer-to-peer influence, of breaking the stigma. And what we find mental health is in that whole of where we have to crack this down, where people can openly discuss a disease, like we can discuss cancers or we can discuss blood pressures. We have to discuss mental health so that early interventions can be possible. WHO, higher health, we all have accredited risk assessment tools, which are community-based, where people can do simple yes and no questions to find and introspect at early stages that they can be vulnerable or they are living with mental health. Because what we're trying to find is at very early stages of mental health, because immediately putting an intervention then can displace the problem and cure a person far further. It applies to any disease, even blood pressure or sugar. Yeah.
So at the point, Professor Ahluwalia, where a person is now battling with suicidal thoughts, and I'm not sure how the process works in the lead up to that, or even if that is indeed the correct sort of phrasing of what happens. What then is usually going on? Because a lot of us battle with understanding, isn't it, what the sort of turmoil that a person would be dealing with at that point when they're either battling with suicidal thoughts or indeed take their own lives.
Absolutely, Tembi. In fact, the data is shocking. In fact, every 4th second in the world, we lose a person to suicide. In fact, 20 attempts are made for one fatality of a suicide. So what you're talking is real. So I'm going to start with a telephone number, which is a higher health toll-free crisis helpline. 24 hours, anytime, totally free. 0860 363636. One must pick up a call, must not find themselves alone when these suicidal ideas or thinking is happening, because that is where the problem is. When you are alone, the aim is to speak to somebody. And there is these psychologists, these lay counselors, social workers who are trained to deal with these crises. And it's important for us to advocate these and build such crisis lines. I really appreciate even South African anxiety and depression group that is putting a lot of efforts, as much as higher health along with them is putting, which is all these organizations, all they're trying to do is putting these crisis helplines and marketing them so that these numbers are on the phone book of your phone and can be used at any time. Because what is needed at that time when you have gone to that stage, because that's a severe stage, it takes long for us to manage, for at least takes 3 working days to get a crisis at least to a stage of stabilization and then referred for a long-term therapy, because it's not that you repaired the problem immediately.
Professor Ramneek Ahluwalia, good to speak to you, CEO of Higher Health. Thank you. The family of a 6-year-old boy from Ermelo in Mpumalanga wants justice.